pulmonologist, global health policy expert, and MS Now senior medical analyst. Good to see you. We talk so often about the confusion this creates in American homes. What are parents, and for that matter, pediatricians, supposed to make of this?
Well, thank goodness that we've had some sort of intervention. So I think there's relief. But there's also sadness that we had to have, Chris, a legal court or the legal system intervene on something that should be fundamentally outside legal purview. This should be something that scientists and clinicians should be discussing outside of the court system. And so the fact that this ripcord had to be pulled is sad. I think it's not sustainable. And I think what we're all worried about in the clinical world is what's going to happen next, Chris. This is an unpredictable administration. Their ACIP committee, this new committee that was ruled ineligible and just not expert to make the decisions that they were making. What are they going to do? And that's the big question.
Well, I mean, one of the arguments that this judge made is that it's the states, not the federal government, that should be making these kinds of decisions. But if you have every state doing something different, people move. People get sick when they're in another state. What are you supposed to do with that?
Well, especially when it comes to infectious diseases, to your point, in Florida, their Surgeon General, if we want to take what Florida is doing, wants to get rid of all vaccine mandates for all school children across the board and make it shared decision making. A lot of people visit Florida, to your point. Families visit Florida for spring break, which is about to happen in the intervening weeks.
I hear there's a couple theme parks there as well.
There's a couple theme parks there, and they're going to bring those, whatever perhaps they get exposed to, back to their own communities. So you're right. You can't have 50 different approaches to vaccine policy. This is what the federal government should be doing. They should be leading with transparency, consistency, and partnership at the local level to disseminate evidence-backed information. That's exactly the whole point of HHS and these ACIP committees. But unfortunately, we have not had transparency, we have not had consistency, and we have not had partnerships.
Now, before the judge made this ruling, Axios did a poll. They found 60% of Americans trust the government's new vaccination recommendations for children. It had been 71% in June before the administration tried to make the change. Are you concerned that this back and forth just further eats erodes, frankly, the public trust in what they're being told?
Absolutely. We have parents now that are asking questions of pediatricians about the rotavirus vaccine. What is that? That was preventing a diarrheal illness that, Chris, prior to its implementation many decades ago, resulted in tens of thousands of kids in children's hospital beds across the country. Hospitalizations that were preventable. Hepatitis B, something similar here as well. We're talking about walking back something for which there's clear impacts ultimately on the people that I think we're forgetting in this conversation, or at least the administration is forgetting. Let's center this conversation on children. That's who is going to be impacted by this. And then, yes, to your point, ultimately families. How do we talk to mom and dad? Do we have enough time to talk to mom and dad about, in the 15-minute visit, counseling them on this and yet the other millions of other things that we need to be talking about? Growth and development, how they're doing at school. There's a lot of other things to be talking about and spending our time on, not on settled science.